Let's say we are part of a sports team training a few kids to play football. One of the kids develops a sudden muscle pull in the back thigh. He underwent immediate acute phase rehabilitation and started to recover well. He's pain free now and able to do his routine activities with minimal discomfort. As a coach, trainer, or a therapist, when do you think he can return to sports? If he can perform routine activities without pain, do you think that he can start his sports training? If you are looking for answers to these questions, you are in the right place. Welcome to this NPTEL course on physical medicine and rehabilitation in sports, and today's lecture on subacute and functional phases of rehabilitation. With me, Wing Commander Dr. Chandrasekhar Guru. I'm a sports medicine's physician, associate professor in the field in the Department of Sports Medicine, Armed Forces Medical College, Pune. In this lecture, you will be learning about the goals of phase 2, that is subacute phase. What are the aims? What are the goals? What are the various strategies to reach these goals in the subacute phase of sports rehabilitation? Or we progress to phase 3 and 4, that is return to sports and functional training, and discuss the various sports specific aspects. And finally, we'll also learn about the practical aspects related to implementing these in sports rehabilitation and taking a decision on return to sports. So, recapitulating what we have seen in the previous lectures, when we see the concept of inflammation and tissue healing in the body, the initial 3 to 7 days is the part of the inflammation phase, followed by the proliferation phase, which lasts till 3 weeks. Subsequently, post 3 weeks, you have the phase of remodeling when the collagen fibers are matured and then finally it gets remodeled. The phases are aligned in these phases of tissue healing. The phase 1 is basically the acute phase, where the main aim is to uh, address or prevent further damage and address the impairment. Phase 2 and 3 are more of subacute and return to sport phases, where in subacute phase we focus main in terms of restoring the function to the level of activities of daily living by improving the range of motion, strength, flexibility, and coordination. Further, when the individual reaches a level of basic strength, we progress to phase 3, which is return to sports or more of a functional phase, wherein sport specific drills and advanced strengthening activities are introduced, and subsequently with phase 4, where we have re-injury prevention program incorporated in their day-to-day training activities. With this background, we also see various targets in each and every phase. We saw in the acute phase, the targets are more towards addressing the inflammation cardinal signs, to control the signs of inflammation, to modulate the pain, thereby increasing the range of motion. In the phase 2, it is more of kind of addressing to the motor control, and in phase 3 it is more towards the advancement of strength training and the various sport specific drills, and thereby the exercise moves from a more of a controlled simple to more of a complex sport specific activities. And in the final phase 4, we introduce more of sport specific injury prevention program. The athlete clears various tests to and get ready to take part in the sports, and be in a state to perform as well, not only returning to function but also to perform at the appropriate level in sports. So when we see about phase 1, we saw in the previous lecture how we kind of address various strategies and various aspects in terms of implementation of acute phase. uh, when do you progress to the subsequent phase of phase 2, that is subacute phase? So we saw you initially start with the police or the price protocol, do some activity modification to reduce the load, have some pain modulation strategies in place, increase the range of motion to a desired level, thereafter restoring the basic function with minimal discomfort, and you progress subsequently to the subacute phase, along with the improvement in the range of motion and the activities of daily living, as well as reduction in the pain and swelling with the help of social support of the coach and the administrator. This is what we saw in the previous lecture. Now moving ahead with the phase 2, that is a subacute phase. The aim of phase 2 is basically to restore the function to perform activities of daily living, which you call it as ADL, that is activities of daily living. What do you mean by activities of daily living? These are like what you perform normally in your day-to-day routine, like taking bath, able to wear your t-shirt or remove your t-shirt, able to comb, able to walk, able to climb up the stairs or climb down the stairs. These are activities of daily living. So the main goal in achieving this aim would be to restore the strength, restore the function in terms of performing the activities of daily living, and also to introduce certain basic sport specific movements so that the motor control is also taken care of. So the phase-wise targets in phase 2 would be more towards maintaining the pain management and range of motion. As we have discussed, if the pain is less than 3 to 4, then it becomes easier for the individual to adhere to the exercise program. So it is important to modulate the pain, keep continuing it, improve the range of motion. So we have addressed the range of motion to a greater extent in phase 1, but then it is important to reach complete full range of motion, and which is pain free, and should be able to load it further with the external resistance. So that is also an important goal in phase 2. And it is important to also address to the motor control that one has during this phase, because it is more of athlete who are being rehabilitated in our scenario. So it is important that the sport specific movements are broken into simple movements, and then gradually they are re-educated and retrained in that particular motor control. Strengthening also is important. So if we increase from an isometric to a more of a low load isotonic exercise activities. So the strategies in order to reach the goal of restoring strength would be to reduce the pain. The pain control is important. As we discussed earlier, the pain should be less than 3 or 4 out of scale of 10. The range of motion, the main goal would be to reach a near normal or a full range of motion where we are able to load it as well subsequently. As we know, because of the inflammation, the muscle around the injured area gets impaired and they are inhibited. So it is important to activate them so that there is neural facilitation. At least before loading them, they get to activate it further. A simple example I will say, in case of injuries around the knee, what happens is the muscle which is more prone to get inhibited is the quadriceps. That is the more so specifically is the vastus medialis obliquus, that is the VMO. This is the inner aspect of your knee. So as a therapist, or as a athlete support personnel who has certain amount of idea about physical medicine, it is important to understand this fact that we'll have to activate it further, because quadriceps is such an important muscle to maintain the strength at the level of the knee. So and our main objective would be to have maximum full range of motion, that is extension of 0 degrees. The extension of 0 degrees is possible only if you have very good quadriceps strength, especially with a VMO, adequate VMO strength. So it is important, in order to develop the strength, it is important to activate this muscle. How do you activate it? You simply ask the individual to place the palm over the inner aspect of the thigh and try to contract the thigh. As the individual contracts it, when you compare with the normal or the uninjured limb and the injured limb, you will feel the difference, the feeling that comes on the palm of the hand. So that gives an input that the muscle is getting activated. So if it is an injured, obviously there will be delay in the activation of the muscle. So you can ask the individual to keep practicing it over a period of time in a calm and quiet environment, that the individual is able to match the uninjured thigh. So this is very important even before starting even any kind of isometric strengthening as well. The next step would be to introduce isometric strength exercises, wherein you need to understand this concept of maximum voluntary contraction. What is maximum voluntary contraction? So for example, if you see, this is my arm, and I'm trying to flex my arm, and so that thereby I'm going to use my biceps, right? So if I want to know what is the maximum voluntary contraction that I can do in an isometric, the therapist can hold the individual and resist the movement of biceps, flexing the elbow. So when I am trying to do it with maximum amount of force that I can use, so that is the maximum voluntary contraction. See, I'm introducing that much of voluntary force, but then I'm not causing the movement, so the biceps is getting activated. So you can ask the individual to assess that this would be the maximum voluntary force in an uninjured limb. For example, if I have an injured left elbow, so I would I would perform in a right elbow and then see this is 100%. So now when I need to perform the same isometric contraction in my left, I would use this as a guideline. So now with this maximum voluntary is 100%, I would do it with about say 50 to 70% on the injured side. So that way you are not increasing the threshold, you are maintaining the threshold. Already you have activated the muscle by means of minimal activation. From there you increase the force production by without causing any change in the length. So that way it helps in kind of increasing the strength, as well as it also prevent further disruption of the formed granulation tissue. So that's the importance of using maximum voluntary contraction in an objective manner to guide the strength generation during the process of rehabilitation. Subsequently, if the individual is able to do, we can progress to something called as light resistance isotonic strengthening exercises using say colored therabands or colored tubes, which can have different sets of varying resistance, and it can be progressed gradually. The main aim in terms of restoring strength should be that comparison can be done with the help of the uninjured limb or side. The aim should be to reach at least 70% of that particular strength. So that is the important guideline when we progress towards the subsequent phases. What about the next goal? The next goal is restoration of function, that is activities of daily living, right? So there should be a clinical improvement as you gauge the individual's improvement over the period of time. The discomfort or the discomfort that the individual faces during performing these activities of day-to-day routine should be minimal. The discomfort should be very less or even absent. So that is the final outcome that we are looking at this particular stage. So it can be objectively measured by comparing with the uninjured limb. As we can say, the range of motion, there may be improvement in the range of motion as compared to the previous week or the previous phase, as well as to the uninjured side. So that gives an idea whether your rehabilitation is progressing in the right direction, whether you need to progress it further or you need to sometimes also come down to the extent that you maintain that phase, and then thereafter you improve it subsequently as the individual's range of motion improves. So similarly is with the muscle strength. Muscle strength, how do you objectively measure? If you don't have any access to any of the facilities, you can use simple manual muscle testing to know grade the kind of muscle power that is being generated in the grading of 1 to 5. If you have something called as a handheld dynamometer, it is nothing but a simple device to measure the amount of force that is being generated by the muscle in a particular action. So objective way of measuring what is the force that is being generated by that particular group of muscles. So that gives an objective value, and that can be used serially to guide the therapist, as well as gives a biofeedback to the individual as well, that how the individual's progression is there during the therapy. So one other aspect of restoring function is by also asking the individual to perform certain functional tests. Functional tests for the upper body would be mostly in terms of wall push-ups initially, and subsequently progressing to knee push-ups, and then thereafter full body push-up. In case of lower body, it can be a mini squat or half squat, and then going on to a full squat, or it can be a hop test as well. It can be double legged hop test or a single leg hop test, subsequently increasing the difficulty level. So that's how you can assess the functional capability, that the restoration of function. The third important is the introduction of basic sports specific movements. What are this? You will have to address the deficits. This becomes an important opportunity for the therapist or the trainer to address this deficit which is already there, or which would have led to the occurrence of the injury in the first place. So it is important to retrain the movement patterns which is specific for that particular sports. Cross training again is important in this period in order to maintain that cardiovascular endurance, as well as not to stress the injured body. So one of the useful mode of training would be using swimming pool in terms of basic pool walking, or even making the individual to do various 3D plane movements inside the swimming pool at different varying depths. Other important aspect of training would also be reducing the weight bearing capability onto the lower body, and then use that would be in terms of using a cycle ergometer or a static cycle exerciser in the gym for maintaining the cardiovascular resistance, fitness rather. Another aspect is that the attention can also be given towards the core strengthening and other uninjured regions, which can also be an opportunity to kind of maintain the fitness or improve the level of strength at these uninjured regions as well. So the benefits is that the individual is not away from the sports, though he or she is not able to participate, but then the opportunity is there for the athletes to be along with the peers. Being along with the peer, the emotional responses are kind of regulated, and they're motivated to come back faster. So the adherence also improves. So it also alleviates the anxiety that the individual has because of not playing. So these are the benefits of involving them along with the team members in a sports environment. So that could help in faster recovery. Now, once that is done, we progress to phase 3. How do we progress? So the individual should be able to attain full and pain-free range of motion by the end of phase 2. The strength, as we discussed, should be at least 70% of the uninjured limb, and he or she should be able to do the activities of daily living with no discomfort or minimal discomfort. The basic conditioning and the basic strength for perform sport specific drills also should be addressed in consonant with the psychological and the nutritional support, with the social support of the coaches and the administrators. Once that is reached, then we progress to the next phase, that is the phase 3. It is the functional phase, which involves the return to sports phase. So the aim of phase 3 is to return the injured individual to the pre-injury level of performance, and to attain this particular goal, we have the aim of developing advanced strength, inclusion of sport specific drills, and finally certain criteria to judge whether the individual is fit to actually go into return to sports. So the phase wise targets in phase 3 would be focusing or maintaining the level of range of motion as well as the pain modulation, because meanwhile when we are improving the strength and the other activities, the pain reduces, and it may reach to a level of no pain or even 1 or 2, which is sustainable, and the individual can continue improving the strength. As the individual improves the strength, the pain actually comes down. Range of motion, again the individual is now able to reach full range of motion, and should be able to maintain the same full range of motion with additional load. So that is again important aspect. With external load, the entire full range of motion should be possible. The motor control, now the individual should be able to do even high speed agility drills also, so that the side cutting maneuvers or jumping maneuvers, these landing techniques, these are all addressed, and the individual is able to practice it in a very professional or as required manner. That is why this phase is mainly predominantly the coach and the trainer plays major role as compared to a therapist. Then the most importantly, we are addressing the advanced level of strength. So the strengthening aspect or the exercises that are prescribed should be simulating more in relation to the demand of the sports per se, and it should be more complex as required for the sports that has to be played. So the strategies here would be to develop advanced strength and sport specific skills. As we discussed, the role predominantly is played by the coach or the trainer rather than the therapist per se. So it is a collaborative effort between both of these group of people, and should be centered towards the athlete's welfare and performance. Traditional strength training can be introduced here. The individual can actually start attending the strength training sessions along with the other players of the team. So that helps also in kind of regaining the confidence. Complexity of the drills can be introduced, wherein the power drills can be introduced. More of eccentric kind of training, plyometrics, box and jump trainings can be used. If the sport specifically involves acceleration and sudden change in direction and deceleration, these drills can also be incorporated during this phase. So the target here is from a level of 70% compared to the uninjured limb, it has to now move on to progress to 90% or even close to 100% to the non-injured limb. So that helps in increasing the strength and the power at the in the level in the injured limb. Functional testing wise, if you see the individual in case of a lower limb injury, the individual should be able to do a single leg hop, and you can have variety of variations in these kind of tests, wherein you can have a single leg hop or a triple jump using a single leg. So you can measure the distance or the landing technique. You can use a simple video record of this and then analyze it for landing techniques. So it is up to the requirement and the professional level of the athlete that these tests can be modified to use it as a criteria based progression. So let's consider a case scenario. So we're coming back to the same, that you are part of the sports team where a few kids are being trained for football. One of the guy developed a sudden muscle pull in the back of the thigh. Initial immediate on-field acute phase treatment was given with price protocol, and he was taken for a medical guidance. Subsequently, he improved well with treatment with good phase 2 kind of rehabilitation, and he was able to walk pain free and able to perform the activities of daily living with no discomfort. His therapist advised him to start sport specific drills as he was gaining the basic strength that is required to play the sports, and you started him on a gradual running training protocol. So as a coach or a therapist or a trainer, how do you make a return to play decision on this particular case? So now he's able to run. So you able to run, can it be translated into a condition where you can return the individual to sport? So there, using all the previous whatever discussion that we had, we can say that is a young athlete, probable hamstring strain. So he has underwent a phase 3. Now he's probably in phase 3 where he's able to slowly gradually returning to sports, and he is able to run as well, and he's able to perform activities of daily living. The strength is adequate and he started to run. So that means he has reached a certain level of advanced kind of return to sports criteria. So you have to consider the condition as well. So hamstring strain, it is more prone for recurrence. It's seen in people, especially in footballers. It is seen that the chance of recurrence is 5 to 7 times more, and the rehabilitation generally has to be very structured, and then it also need to include the phase 4, that is long term injury re-injury prevention program, so that this recurrence can be reduced. And it is important to assess these factors before considering the decision for return to sports. One is the tissue health. So you can assess it by if the individual is able to do his activity of daily living and how the symptoms have improved. Second thing is how much the tissue can take up the stress, tissue stress. That can be assessed by asking the individual to perform certain functional tests relevant to the sport. Say you can ask the individual to sprint and do some box jumps. So if these are producing any symptoms, or if the individual is able to do, that means yes, the tissue stress is also good. Biomechanically, this needs to be assessed because there may be landing problems or cutting strategy related issues which is causing the individual to be more prone for such problems or injuries. So asymmetry can be checked between limb to limb asymmetry, and also the program should also include certain eccentric kind of contraction activity, wherein that is very important to control the deceleration when the individual goes for sprinting. So eccentric activity in terms of Nordic protocol is followed globally to kind of increase the eccentric strength of the hamstrings. So that should be part of the program, and it should also be checked as well. Specific strengthening protocol, as we said, eccentric kind of strengthening protocol, and that should be included as part of daily training program in the sports training program itself, even after return to sports. So the adequate kind of warming up of the individual, and then thereafter cooling down has to also be taken care of. If all these things are there, still, do you think the individual can return to sports? Still, it is very difficult to say on one or two, based on one or two factors. So it is a criteria that has multiple things that needs to be considered, starting from it is again not a individual decision. It should be a collective decision by the entire team. So the views of the athlete, the views of the coach, the views of the trainer, and the therapist and the sports physician have to be taken into consideration. Subsequently, there should be a detailed rehab program that should be in place depending on the level of athlete, the phase in which the individual is, the phase of training, assessing various risk factors, including the individual's tissue, or the requirement of the coach and the team. If it's a commercial team, how about the requirement from the team managers, and then how the individual is able to clear various functional tests that we have discussed so far, and so forth. Based on that, depending on the stage of season, pressure from the athlete per se, whether the athlete is in the peak of the thing, or how important the athlete's role in the team for winning the particular game or the the tournament. External pressure in terms of pressure from the coach, pressure from the family, if it is a student athlete, about the the requirement in performing well in the college. So these are various pressure that needs to be considered. How well the injury can be further masked so that it doesn't end up in a re-injury. So that is also important consideration that needs to be taken. Obviously, with a lot of decision need to be individual decision is not generally preferred because of the conflict of interest that may be there. So it is always a collective team approach that can resolve this kind of conflict of interest. And obviously, with more of commercialization of sports, fear of litigation is again a major thing. So accordingly, whether the individual has to be timely return to sports have to be done, or it has to be withheld, it depends on various consideration of all these factors, and then a considered decision has to be done, again keeping athlete as the center. So athlete centered approach is very important. To summarize, the phase wise rehabilitation provides a structured progression. The restorement of function starts from addressing the impairment to activities of daily living to sport specific restorement of the performance level. Restoring strength would mean to first activate the muscle, thereafter match the or compare it with the uninjured limb, then subsequently progress to advanced form of strengthening protocols. Motor control and retraining forms the major baseline foundation for successful sports specific rehabilitation. A team approach, as I mentioned, is very important in kind of decision making in return to sport. So incorporating always the long-term re-injury prevention program as part of the sports training microcycle or the macrocycle helps in kind of reducing the risk of re-injury. So for those of you who wants to further dwell in depth in these particular concepts, these are the books that I have suggested here. Thank you for being with me in this lecture. Thank you, and Jai Hind.